patient presents today with low back pain, knee pain, and hip pain. And they are also in a flex position at the knee and the hips whenever they are in posture or in their gait. So today we are going to be testing the Gluteus Maximus, because in order to get the hip from the flexed position back to a neutral position, we will have to flex or extend the hips. So first, do I have consent to treat you?
Yes.
Okay, so in order to start the process of the testing, we are going to have to start with the erector spinae, because the Gluteus Maximus is a two-part test. So in order to test the erector spinae, I'm going to have my patient place her hands on the back of her head, like Superman. I am going to stabilize the bottom of her legs, and then you are going to come up. Okay, so since she can hold that against gravity, we know that she can maintain the anterior tilt of her pelvis, so she should be able to do the glute max test. So the glute max is innervated by the inferior gluteal nerve, L5, S1, and S2. The attachments are the posterior lateral coccyx and sacrum to the iliotibial tract of the fascia lata and the gluteal tuberosity of the femur. And then the glute max is a hip extensor, hip external rotation, and then the upper fibers assist in abduction and the lower fibers assist in adduction. So to set this test up, we're gonna have the patient flex the knee. We're gonna have slight hip abduction, a little external rotation, and then have the hip extended off of the table. So I'm gonna have her hold this position. She can hold this position, therefore she's automatically at a 3 since she can hold against gravity. I'm gonna go ahead and get into position. So I'm going to stabilize her opposite hip, and then I'm going to push down right around the knee. So I'm going to hold. Okay. So I'm gonna give my patient a 4 out of 5 for this manual muscle test. This is because she can hold moderate to strong pressure, but I do think I can break her. And then the gravity minimized position for this we would have our patient laying sideways, side lying. The non-tested leg would be flexed at the knee and the hip, and then the tested leg would be extended at the hip and flexed at the knee. They would be holding it up, and then the therapist would be pushing into flexion, and the patient would be trying to stay in an extended position.